Hi, you guys. It's Dr. Baker Thompson, and I want to talk to you about your HEENT assignment. So, the first thing is you have to go to Shadow Help, and you have to complete the assessment on Tina. So, the things that you're going to need is your health assessment book. You have to go to the HEENT part of Shadow Help and fill out the information. So what I did was I made you a template. Someone earlier told me this morning that it would be easier if there was a template. And so therefore I made you one. So let's look at that real quick. So here is your template. Sorry, it's taken a while to download. Okay, so here's the template that I made you. So here's the assignment. You're going to type your name here. All of this is done. And then you're going to put in the date. You should have asked the review of system questions from the review of system supplement for your history. That was all of these questions. So hopefully you've already done that. If you haven't, you're going to need to ask all of these questions, because this is the review of systems, or the questions you asked about that particular system. So if you've already asked them and you did that in your history, then you're simply just going to cut and paste the information from your history into this document. So when you document this, you're going to describe it in positives and negatives. So, patient denies frequent or severe headaches or problems with dizziness. Patient admits to wearing corrective lenses. And then you say, when did you have to do an OPQRS&T on any positives. Onset, palliative, what makes it worse or better. So if she wears corrective lenses, it makes her, she can read when she wears her glasses. It's worse when she doesn't. Quality, is really not one for wearing corrective lenses. Radiating, not either. Severity, how bad is it? Is she 2100 without her glasses? And if it were pain, of course it would be a pain scale. And is it worse at night? Is it worse when she drives, or whatever? So any positives, you're going to do an OPQRST, and any negatives, you're just going to say that she denies. Then you're going to come on down, and you're going to do your vital signs on Tina Jones. And you'll do heart rate, respirations, O2 sat, blood pressure, and your pain scale. Then for every single system, we do inspection, palpation, percussion, and auscultation. Of course, sometimes you don't do all of these, such as you don't auscultate the head or the scalp. So you just put NA. I did a little example here. This is not finished. I just did it so that you would kind of see what I'm looking for. You're going to continue to do this on inspection of the eyes, inspection of the eyelids, inspection of the sclera. Well, the sclera is white. And so you can see you're going to continue with all your inspection things that you look at from your textbook, usually your Jarvis, your health assessment textbook. And then if you palpate the eyes, you would put it here. If you percuss the eyes, you would put your findings here. If you auscultated the eyes, then you would put your findings here. Of course, we don't do that for this system, so you don't. Now, tests. There are a lot of eye tests. So you're going to do extraocular movement, which is where you have them. You focus on your finger, and then you go out and down, and you do the 6 cardinal fields of gaze. You look to see that their eye movements are equal, and that there's negative nystagmus. You look for perla. There's more tests that you're going to do. I just used this as an example. So you're going to go on and you're going to do all of those for this. Like ears, you're going to do a hearing test. You can do a hearing screen, a whisper test, or a Weber, or a Rhine. Same thing with all of these. Then when you finish, you're going to do a nursing note. You're going to say, you're going to put your what her assessment, what they're positive for, because you already have your review of systems information up there. Then you're going to put your two nursing diagnoses here. So that's it. If you have any questions, please let me know. But you have to use your textbook, and then you have to go through all the assessments with Tina and then document them here. And then you'll upload this form. I will continue to make these forms for each system to make it a little easier for you. Thank you.